Now, in South Africa, the number of coronavirus cases leapt to 554 this Tuesday. The news comes 24 hours after President Cyril Ramaphosa ordered South Africans to stay in their homes. There are exceptions, like elsewhere, including those who seek medical care, need to buy food and supplies. The country will be deploying its National Defence Force to ensure that the measures are implemented. Now, for more on this story, I'd like to welcome Judd Devermont to the programme. He's the director of the Africa programme at the Centre for Strategic and International Studies, and he joins us from Washington, D.C. Thank you so much for being with us here on France 24. Certainly, I think one of the biggest questions for us is, yes, cases were much slower to trickle into Africa as a continent, but are they potentially quite late with the measures that they are now taking on? In a way, we can say that they had a heads up from the rest of the world.
Yeah, they certainly had a heads up, but I think what has happened in South Africa or other African countries is not unlike what's happened in the rest of the world. Until you start seeing the caseloads, until people start dying, governments have been reluctant to impose harsh restrictions because of the economic blows and because perhaps they feel like they're inured to it. But what I would say is that South Africa at this juncture is probably the most aggressive on its approach towards this disease, in part because of the number of infections and the 21-day shutdown. No other country in sub-Saharan Africa has done that. And what I think is particularly important about what Cyril Ramaphosa, the president, is doing, he is working across the political aisles to address this problem. In no other country have we seen such a unified political class to try to confront this problem head on. And I can say that's true even of my own country.
It's interesting that you mentioned that those strong measures have been put into place. But what's also interesting is that reportedly South African health workers have actually carried out already more than 12,000 tests for coronavirus, but not yet registered any deaths from the outbreak. Do we have any idea as to why that may be?
No, I mean, I don't know. I'm a political security analyst, so I can't talk to the public health. I do think that, of course, eventually deaths will come, and they'll probably come first to elites. That's what we've seen in the developed world. That's what we've seen in sub-Saharan Africa. Just today, we found out that Mano Dibango, the famed saxophonist from Cameroon, passed away. And so when we do start seeing deaths in South Africa, it will almost certainly be elites. And that will really drive home how serious this disease and the human costs.
We will be actually speaking about Mano Dibango later in the program. But just one last question for you. There are concerns that the virus could overwhelm the health system, not just in South Africa, but across the continent, of course, if infection rates do rise steeply, which they may well.
I'm sorry, can you say that again?
Yes, I'm just talking about concerns, not just in South Africa, but across the continent, that the health system may be overwhelmed with various cases if, of course, those number of infections rise rather steeply, which is expected.
Yeah, I'm very concerned about the public health systems in sub-Saharan Africa being able to address this problem. As I've been worried about it in other countries, including in the global north. Some countries have experience with pandemics like Ebola, but nothing is going to be on this scale, and it is going to tax the systems. And unfortunately, I think that there's not been enough response from Africa's partners to help them navigate this, in part because they're dealing with their own problem sets. In fact, the only person who seems to be really leading the charge is Jack Ma, the Chinese internet tycoon. And then from the EU, the US, and other countries, it's been a trickle of support spread across the entire globe.
And one last question for you there, Judd Devermont, about the funds that the Chinese and the help that the Chinese are at the moment providing for the continent.
Yes, so the Chinese are providing some support. Jack Ma, as I said earlier, has pledged about $6 billion equipment, and then the Chinese government has done assistance. We don't have a real strong sense of the numbers. It seems to be largely medical supplies and screening, and they're now offering their technical expertise. And so like the total number isn't clear, but they're making an impact because these things, talking about what you're providing, not necessarily the dollar amount, are most impactful, most granular, something you can hold on to. And so they have been able to pivot from being the initiator and the source of this problem to being one of the global responders.
Judd Devermont there of the Centre for Strategic and International Studies. Thank you so much for speaking to us here on France 24.